sincero. Tengo la necesidad de saber lo que piensas.
Hi, Octavio. We would like to test sound and video for Dr. Ferrer. Testing for Dr. Ferrer. Can anyone hear us? Oh, thank you. How about the video? Is it bright enough?
Also in California. We are in South
They didn't start it yet. They said they can hear us.
Okay. officer that was supposed to be here today, and said he regrets, but I was like, it has to be something con ganas, like a call that says like, go do it. And then somebody said, just do it. And obviously we didn't want to get into copyright infringement. And so we're like, just do it. And then I remember, and I will take credit, I have witnesses in the room that I said like, ándale, like si se puede, go do it. And then somebody said, ándale, qué esperas. And then there it was born. And, we have gotten the most amazing feedback, but also I think what I want to call out in that story is that it resonates with our community. We all understand what ándale means, whether you're Latino, speak Spanish or not, right? We understand that. It can be like, ándale, hijo, go do it for your family. Or it could be like, ándale, ya, es tiempo, go do the thing and convey that sense of urgency. And so we are just really so proud.
Now have the pleasure to introduce another colega and sister in this work, mom in this work, Lizelle Escobedo, who will be introducing our first general manager.
Okay,
Thank you to my boss for letting my leads kind of write down all my dreams. So that was a very special guest for you all. Someone who was also at the forefront of Mel Ellie during the pandemic. And so we're really excited that although unfortunately she couldn't join us in person, she will be joining us live as we here. I know Ferrer is working at it. And so I wanted to introduce Dr. Ava, who is the director of the LA County Department of Public Health. Has been a huge ally for us, not just as Ultimate, but also under the Ándale, Qué Esperas work. So we feel very honored and privileged to have her here virtually with us. And so without further ado, Dr. Ava, thank you.
Muchas gracias. Thank you so much, Berenice, and to everyone for the kind introduction, all the support. I'm obviously honored to join you in this convening. Sorry that I'm virtual, but mostly, I just want to start with sort of a deep appreciation and acknowledgement of the tremendous work that the community-based clinics have accomplished. And I don't want to just limit that to the work around COVID. You've been in our communities before the pandemic. You've done just amazing, skilled work during the pandemic. And our communities are very blessed that you're going to be there with them after the pandemic. And for that, I want to thank you. You've always been trusted messengers and trusted providers, trusted friends and family for your community residents, and for that, I'm grateful. I have an echo here. Is there an echo that you're hearing as well? I don't know if folks can just mute other folks maybe, and so we can see if the echo disappears. Okay, we'll try. So I also, want to give a huge shout out to Altamed. I mean, the entire team at Altamed. You all know that here in LA County, you are one of our best partners, have been forever. And leading the way on what it means to be flexible and responsive to the many needs that community residents have during a pandemic. And of course, I also want to thank all of the other partners that are here today. I want to thank Dr. Reynoso, the Executive Director of the Latino Coalition for Healthy California, and our community partners, La Clínica de la Raza, Golden Valley Health Centers, San Isidro Health Center, and the Latino Health Access organizations. You've all been, sort of leading the way in our communities for many, many years, and we're grateful for the partnerships during the pandemic. Unfortunately, I have a very hard stop at 10:30. If I could get the first and second slides up really quick, and then we'll just start moving through. I'm not sure if I can't see them on my side. I am not sure if you're all seeing them. That will be fine as long as I know that you can see them. Okay, I'm gonna keep going, and I'm assuming I can't hear anybody, so I'm just gonna assume that you guys are seeing them. Otherwise, I'll just do my best to sort of talk, and hopefully you can have the slides circulated at a later date. I did want to talk a little bit about the COVID trends. I want to talk a bit about mitigation and the partnerships. But I want to focus most of my comments around disproportionality and what that means for this post-surge period that we're in. Oh, perfect. Okay, so I am now on slide number 3, the 7-day average daily COVID-19 cases. So just again, this is from the very beginning of the pandemic. You all can see we've had 4 noticeable surges. A surge is when we have increases in cases followed shortly thereafter by increases in hospitalizations. Cases are that green line, hospitalizations are the orange line, and then tragically always followed by increases in deaths. You can see that the most significant increase that we had in cases was recently with the Omicron variant. Cases where we were averaging for a little bit, 45,000 cases a day in LA County. And you all lived through this. Wherever you were in the United States, Omicron had a devastating impact on our communities. Next slide. And recently, we've started seeing an increase in cases as well. This is looking at just the past month. You can see while we're seeing an increase in cases, we don't see yet a corresponding increase in hospitalizations or a corresponding increase, fortunately, in deaths. This could just be because there's always a lag between cases, hospitalizations, and then deaths. Or it could be that we're actually, with all of the protections of the vaccines, with all of the protections of the people who are boosted, and with some natural immunity that people have from being infected during that last surge, we're not seeing as many people experiencing severe illness. But the jury's still out on that. So we do continue to need to be cautious. On the next slide, which is mitigation strategies. I just want to point out that throughout the last more than 2 years, almost 2.5 years, we've really relied on 3 different sets of mitigation activities to help us manage our ability to be as safe as possible during the pandemic. We rely heavily on what we call non-pharmaceutical interventions. These are things like being able to wear masks, being able to distance. We've closed places or limited capacity. We need good ventilation because this is an aerosolized virus. And sometimes we've issued health officer orders, which have really then had the force of law around some of those mitigation efforts. And other times we've asked people to take personal protective practices. We've also relied a lot on testing, vaccination, and therapeutics, built out provider networks. You all are part of the massive provider networks, and really made sure, at least here in LA County, that we have lots and lots of community sites that are able to help us with testing, vaccination, and now the distribution of therapeutics. And lastly, and this again, an area all of you know too well, we've needed to be available to provide additional care and support to people who have been affected by the pandemic, both had their health affected and their livelihoods affected. We've also really implemented massive contact tracing, being able to reach people who are infected so that they know what they can do to protect themselves and their loved ones and connect to services, including setting up quarantine and isolation sites where people who don't have resources to safely isolate at home or away from others can go to a hotel in LA County where they will have wraparound services while they quarantine and or isolate. And there's been a lot, as you know, of information sharing. I want to note that we've had about, in LA County, about 700 community health workers, promotoras, that are part of this effort, a massive effort on sharing information and answering people's questions. And without that, I would venture to say that the information sharing part of our effort would have fallen far short of what it needed to be. Next slide. These are some maps. I just want to focus on the massive efforts to create these networks. Here in LA County, we have over 330 testing sites. These are testing sites that are free for people who don't have health insurance. We obviously, if people have health insurance, we like to collect that information, but they are open to everyone and they are barrier free for everyone, regardless of immigration status, regardless of whether people have or don't want to share their information. Next slide. We've also, thanks to all of your help, massive efforts on having vast numbers of vaccination sites. Here in LA County, we have over 1,000 what we call fixed sites where people can go 7 days a week. We also have somewhere between 600 and 800 mobile teams out every week, popping up at work sites, at churches, at temples, at shopping centers, at community events, making it very easy for us to be where people are at in order for them to have easy access to vaccinations. And the next slide shows the work that we've been doing to make sure that now that we have new life-saving therapeutics, people are also able to easily access therapeutics. Here in LA County, we have over 625 sites. These are mostly pharmacies where people can get those medications. I'm talking about the new oral medications, the antivirals. Some of this includes some of your clinics where you have pharmacies and can distribute, and some of it includes other community clinics. Here in LA County, we've also stood up what we call a telehealth option. So for people who have a test result, this can be a home test that you took in your house, you don't have easy access to a provider or a site to go, you can just call our phone lines. We're open 7 days a week from 8 in the morning till 8:30 at night. You can be interviewed by a nurse and then a physician to determine whether or not you're eligible for the therapeutics. If you are, we will overnight the medication to you or send it to a pharmacy of your choice. Again, making it super easy within 24 hours for people to have access to those treatments. As you know, those antiviral treatments need to be started within 5 days of people starting to have any mild symptoms. I also want to note we connect people to the host of other therapeutics, most of which require that you then go to a clinic site for those. They're either given by injections or by an infusion. Next slide. We've really, you know, with your help and all of the other community partners, as you can see here, the strategies have been for us to really make it very easy for everyone to get access to these vaccines, as well as now the therapeutics. You know, we have large community sites, smaller community sites. We have mobile teams, as I noted. We go vaccinate people in their homes. We have pop-up vaccination sites, and we've done everything we can to remove barriers. We will arrange for transportation. We don't require any appointments at almost all of the sites. We don't really require many proofs at all. There's some age eligibility requirements, obviously, for children, but again, those parents can self-attest or caregivers. And again, no need for government issued IDs. Again, you know, the message here, and it's something I think we've learned from all of you, is we need to make it easy for people to have that access and have it be barrier-free access. The second thing that we've learned, and we can go to the next slide, is that we need trusted messengers of information. Getting vaccinated is, for many people, a complicated decision. You know, this country doesn't have a great track record, and they're, because of that, on you know, providing services and caring for folks who are Black and brown, for people who are poor. And I think over the decades, that's built a lot of, you know, sort of distrust. And we need to acknowledge that that distrust, in some cases, has been deserved, because many of us have unfortunately not been attentive to the needs in some of the communities that are hardest hit right now. And this government has a long-standing reputation that is hurting us now in terms of really siding with our drug makers, often to the detriment of our communities. You don't need to look any further than recent examples around the authorization of birth control, contraceptives, the opioids that were approved easily, and even you know, what we're seeing now around the approvals for some electronic nicotine therapies. So I understand why people are hesitant, and I am so grateful for all of you and the efforts that your teams have made to be trusted emissaries of accurate information, and most importantly, to listen and answer questions. But this has been a huge effort, and these partnerships have been with all of you, with other organizations that have community health workers, so we're able to provide resources for those organizations so that they can train and allow their community health workers to go door to door. We have a community ambassador program, we have a parent ambassador program, we have a student ambassador program, so we can actually train our residents, our students, to be their own advocates and to educate their peers. And again, working in partnership with clinics, with our schools and our school districts. And also we've stood up what we call public health councils, which are opportunities. I think we have over 45 public health councils now, opportunities for workers, particularly in non-unionized work sites, where there are lots of low-wage workers, to be advocates for health and safety at those work sites. Next slide. But tragically, in spite of all of this and our efforts to ensure easy and widespread access to testing, vaccines, therapeutics, and good information, we have a lot of disproportionality. And the tragedy of the pandemic is not just a huge number of lives that have been lost. You know, we're approaching 32,000 here in LA, 1 million across the country, but also the huge disproportionality, most pronounced during the surges, which suggests that the factors that contribute to the gaps are related to much more than individual behaviors. So we're going to quickly look at some of the evidence of the gaps. So we're going to run through these pretty quick. The first slide, and then we'll go to the next slide, is what we've seen on case rates. So you can see at every surge, the green line, the blue line, that's the experience for the Latino, Latina community and the Black community. They've always had the highest case rates. Next slide. And during our surges, same communities, Black and Latino communities, have also experienced the highest hospitalization rates. During the Omicron wave, the hospitalization rates for African Americans were 4 times the rate for everybody else. And for Latinos and Latinas, it was about 3 times the rate. Next slide. Tragically, this then corresponds to the disproportionality we've seen in death rates, where Black and Latinx communities have been the hardest hit. And if you go to the next slide, you can just see what these numbers have looked like over the course of the pandemic. These are case rates, hospitalization rates, and death rates from the beginning through April. As you can see, the case rates have been highest for the Black and Latinx communities. Hospitalization rates also correspondingly higher. There's a direct relationship between getting infected and needing hospitalizations, and then tragically much higher death rates amongst our Black and Latinx communities. Next slide. See the same thing. If we look at spread by geography, and many of you may not know LA County, but the darker shaded green communities are tragically also our communities with the highest rates of poverty and our communities with highest concentrations of Black and brown residents. Next slide. You see this also tragically among deaths. The darker blue shades are the higher rates of deaths. And again, same communities disproportionately where residents live who are poor and also Black and brown. Next slide. I want to point out that just like we saw in terms of differences by race and ethnicity, over time, we have also seen differences in case and death rates by communities that have high rates of poverty when compared to communities with lower rates of poverty. You can see that case rates are 1.5 times higher in communities with higher rates of poverty when compared to our wealthiest communities, and the death rate is 3 times higher for people living in communities with high rates of poverty. Next slide. We do know vaccines are powerful and they continue to demonstrate a lot of protection against infection and against severe illness. So it's important to look at the impact of vaccinations on disproportionality. And I want to note that if you look at hospitalization and death rates by vaccination status and race and ethnicity, you'll see again a continued gap. This is for the 3-month period that ended April 15th. For all racial and ethnic groups, the vaccine, as you could see, provided a great deal of protection from hospitalization and death when compared to unvaccinated residents. Fully vaccinated Latino and Latina residents were more than 4 times less likely to be hospitalized and nearly 8 times less likely to die than unvaccinated Latinos and Latinas. Fully vaccinated Black residents were nearly 3 times less likely to be hospitalized and 4 times less likely to die than unvaccinated Black residents. However, it's also clear when you look at this that vaccines are not equalizers. Vaccinated Black and Latinx residents were 2 times more likely to be hospitalized than vaccinated white residents and more than 3 times more likely to be hospitalized than vaccinated Asian residents, and similar differences for Black residents. Next slide. If you look at the case, death, and hospitalization rates by vaccination status and poverty levels, again, similar gaps, super important for people to be vaccinated. But fully vaccinated residents in the wealthiest communities were more than 2 times less likely to be hospitalized than those vaccinated and living in communities with high rates of poverty. In fact, those people that were vaccinated that lived in communities with significant poverty were almost as likely to be hospitalized as unvaccinated people living in the wealthiest communities. And it's also important to note that those who are unvaccinated and live in communities with high poverty are 11 times more likely to get infected than those unvaccinated living in the wealthiest communities. And sadly, you see a similar gradient around deaths. Those who were unvaccinated living in high poverty communities, 12 times more likely to die than unvaccinated residents living in wealthier communities. And among those vaccinated, those that lived in communities of high poverty were still 2 times more likely to die than those who were vaccinated in wealthiest communities. And I want to note that this difference that we continue to see really speaks volumes to the issues that in terms of the pandemic, where you lived and where you worked had an enormous impact on how well you did. Next slide. Not surprisingly, these enormous gaps that we just saw in COVID outcomes also had an impact on our overall death rates. So this is what we call a trend line that looks at what we call all-cause mortality, people that died from everything. And it looks at it from 2011. You can see that historically, African Americans, Black residents in LA County have always had the highest mortality rate. And that Latinx residents, until recently, actually had lower overall mortality rates when compared to white residents and white residents. Asian residents have historically had the lowest mortality rates. But you can see here, everybody's mortality went up, but the largest increases we're seeing, again, not surprisingly, because we just saw data about disproportionality for Black and Latinx residents. The next slide shows you how big those gaps were. For Latinx residents, between 2019 and 2021, they had a 48% increase in all-cause mortality, mostly caused by COVID illness. Black residents, 43%, Asian residents, 22% increase, and white residents, a 7% increase. Next slide. And while I know it's very easy to run to judgment and assume that in part this is caused by people's individual behaviors, I want to note that historically, gaps in health outcomes by race and ethnicity have been documented, as you can see here, for decades. This is looking at 2020 mortality rates. For nearly every single indicator we track, Black residents had the highest death rates, followed by Latinx residents. Next slide. I want to be clear that we have so much evidence. This really is not about individual behaviors. And it's not even about people's access to healthcare. As you can see, we have vast networks of access to testing, vaccinations, and therapeutics, and that's not sufficient. It's not sufficient because all kinds of social conditions contribute to people's health and well-being. Economic stability, education, neighborhood and the built environment, your exposures to environmental hazards, and social and community context. And that's all overlaid with experiences of racism and discrimination. Next slide. And as you can see, if you look at these social determinants by race and ethnicity, you will see that Latino and Latina residents, along with Black residents, really actually experience sort of much higher percentages of economic insecurity, of food insecurity, much higher rates of experiencing discrimination at workplaces and at and when they're trying to obtain healthcare. And next slide. And as a matter of fact, this is all well documented in what we call the Healthy Places Index, which really looks at 25 different community characteristics, including pollution levels, access to healthcare, safe housing, quality education, healthy foods, and puts them together in a composite single index HBI score. And as you can see here, those communities with the lighter and darker shades of blue are those communities that have the least amount of health affirming resources. And if you were to overlay this map with the map of where we saw the highest rates of COVID illness and deaths and the highest rates of mortality, it would really follow very similar. It would look very similar to the areas shaded in blue here. And I'm going to just close very quickly with what this means for post-surge. The focus, so we go to the next slide. We have to keep in mind that health equity means that everyone has the opportunities and resources that they need for optimal health and well-being. And that's not giving everybody the same thing. Equality would be giving everybody who had a transportation need the same bike. Equity would be giving people a method of transportation that works for them, as you can see on this slide. For us moving forward, while we know many people would like us to be done with the virus, because of all the disproportionality, we need to stay focused on collective preventive efforts that actually keep people safe from serious illness and death and address the huge gaps we see. Vulnerable populations are not just those that are unvaccinated. They're not just those that have underlying health conditions or those that are older. They're also Black and Brown residents and residents that have many exposures at work and in the community. Next slide. In order to do this work, we have to make other kinds of investments. Not enough, although we certainly have to continue to make investments so that people have easy access to testing, vaccination, therapeutics, PPE, good information. But we also have to improve the ability of the healthcare providers in our hardest hit communities to be able to provide these services. They need to be well resourced. The public health infrastructure is not just the public health department, it's all of you. We also need to make sure that our trusted community organizations, more than just our clinic systems, also need to get consistent resources. We can't ask them to help augment services and with a 3-month grant, and then we go away, and then when things are bad again, we come back. That does not work, and it does not create the opportunities for us to close those gaps. We have to improve protections for workers. A lot of the gap that we see in our Black and Brown communities, our poor communities, is because many of those workers never get a chance to telework or stay at home. They have lots of exposures at work. And we need to acknowledge that by passing laws that actually protect workers, not just during a pandemic, but from all kinds of occupational hazards. I want to just close with the next slide that really acknowledges that there's also work that we need to do that's specific to closing the gap. Primary amongst these is we got to partner with others who are leading efforts to change systems, policies, and practices that perpetuate racism, discrimination, and marginalization. As I noted, we've got to build the partnerships and the resource allocations for all of you and our community providers, and we've got to continue to pass protections for those who are most vulnerable during the pandemic. With that, I'll close. Unfortunately, I'm not going to have any time for questions, but if it's okay with you, Berenice, if folks want to send their questions, we will respond in writing at a later time and get that out to everybody. I'm so sorry that we're running a little behind, but I do want to just acknowledge how much I've appreciated every single one of you, all of your teams. There's not a single day that you haven't been out front and you've been saving lives. So mil gracias a todos. It's been my honor to get to work alongside so many of you. And I know we have more work to do, but I'm always encouraged and hopeful because of these partnerships. So thank you so much.
Gonna be
So much, Jeff. I was gonna do what I usually do, which is like, you hear me clap once, right? So now we're in the panel portion. We're hoping that we can bring all of the lessons learned, right, from the campaign to you all as we continue to do this work. We continuously keep hearing it's not over, right? And we're like, okay, we got it, but what are the tools, right? What are the resources? What is the information that we share of what we've learned in this work? And so I'm very privileged to be sitting here with just some amazing colleagues that I feel like every time that I talk to them, I learn something new, right? Every time I talk to Rosa, for sure, I'm like, oh yes, street vendors. And so I'm really excited to share the stage with them all. And so what I want to start off doing is having each of them introduce themselves on the work that they do. We have someone from the California Department of Public Health who came through for us last minute, so thank you, Michelle. Sorry, Noelia Michelle. Did I get it right? Yeah. Okay, got it. And so I'll have them introduce themselves and then we'll just dive into questions. This is going to be very conversational. This is for your benefit. And so if folks do have any questions that they want to ask, we'll have some opportunity at the end. But please feel free to kind of flag me down if you want to give me a post-it note to ask a question. Again, this is for you. And so I'll start us off kind of here from left to right and have my colleagues, folks heard from it earlier today, but have them introduce themselves on what is the work that they do, that they've done around COVID, you know, who do they work for, and just share a little bit more about yourselves. And I'm really excited that it's a panel full of women. So just put that in there. So we'll start with Liz.
Pues ya nos conocimos a little bit, so I hope you guys got to know a little bit about me and the passion that I really have for this work. And as the day goes on, I want to meet all of you because I think that we all kind of come, you know, that, like they say, we're cut from the same cloth, right? Venimos de las mismas familias, comunidades, etc. And so I'm so happy that we're here. But you know, I was sharing with a group of promotoras from La Clínica that I often, as you know, one of the executive sponsors for this project and program, I often feel very removed from the work. And my role and position for this campaign has been to put out as they call the raging dumpster fires, right? Once an issue gets to me, it is the issue of the moment, and I'm tasked with mobilizing executive leaders, community leaders, my team and staff internally to fix the issue. But bigger than that, I'm tasked with holding our elected officials, stakeholders, and leaders in the community accountable to this work, and why it's important, like why it matters, and why they need to prioritize the communities that we're serving through this campaign. And so I get to carry that message every single day. I was just in Sacramento. I was telling them, I'm like, what day? Earlier this week. And you know, that's something that I hold really closely. So for me, my role and really honor in this campaign has been to serve as your lead and your partner to carry out the work, but also, again, to hold people accountable. So cuidado if you get called to Ver's office, porque I have something really nice to tell you. But also, honestly, with the results of this work, they cannot deny that we are so effective in reaching communities, and what makes us different is that we speak the language, we look like the community, we come from the community, and they trust us. And that cannot be replicated by anyone unless it's an authentic connection, y de veras somos esas comunidades. And so that's been a little bit about my role. It's great to be with you guys today.
Buenos días a todos. My name is Noelia Michelle Yun. A little bit about myself. I am an immigrant. I was born and raised in Buenos Aires, Argentina, and came here to Los Angeles, lived here for 20 years. Some of you are doing some math maybe. And I am undocumented, and I started my work with community as an organizer, and I am so honored and humbled to be here today, because I know that everything that we've made possible in the last 2 years wouldn't happen without all of you and our trusted messengers, our communities, Ultimate, YMCA. These are all places where community can go to. They're places where community work, live, and play. And we have a big role. We've been here for a really long time, even before the pandemic, and we've really stepped up during the pandemic to try to address and cater to our communities. So I worked on a few other campaigns in the past, the most recent before the pandemic on the 2020 census, which that itself was a big, big monumental task. Even more so in LA County, which is a very diverse county. And now was brought on to work on the COVID-19 campaign at the California Department of Public Health. I'm the Senior Operations Officer for the Vaccine All 58 campaign, responsible for COVID-19 outreach and education across the state. And again, we couldn't do it without you. I think every day we know that our trusted messengers are working in community every day, every second. And some of us are also taking it home, right? Because like these are our siblings, our parents, our grandparents. So I'm just very grateful to be here and excited to learn from all these amazing women here today.
Good morning, everyone. I'm going to be removing the mask because my glasses are fogging up. But my name is Rosa Vasquez. I am currently a consultant with the Ultimate Institute for Health Equity, and I lead our on-the-ground Orange County and Los Angeles outreach campaign with a lot of the team members sitting back there. Huge shout out to them, because none of the work would be possible on the ground, or at least the ultimate work on the ground would be possible without them. A little bit about me is I grew up in Santa Ana, California. Also was an undocumented individual and an undocumented family. And I think that experience of like growing up in the community and seeing firsthand how the health system failed us so drastically really made me believe that there could be a better world, that there could be better ways of our communities existing. And that led me to get involved in politics and in organizing. But through that process, I kind of realized that I was more in the business of building power and equity for community rather than for individuals. And so I'm kind of here now with the guidance from my mentor Gloria, who's sitting to my right. So yeah, I think that is what guides me and what inspires me. It is those lived experiences that I know that I share with my community members. And it's what I center in all of the work that I do. And it's why I think a lot of the work that I do is not about my voice being heard. It's not about like what I want or what changes I think need to happen, but rather about me leveraging my privileges of knowing that I got to have an education. I got to be in this country in ways that my parents and other people like my parents would have never been able to, and opening a space for community themselves to lead and to have their voices heard. So yeah, it's a little bit about me.
Hey everybody, my name is Gloria Montiel. So I am also undocumented, grew up undocumented, now currently under DACA. I had the immense privilege of going through Ivy League colleges, getting my PhD at the Claremont Graduate University. But where I really got my training on what equity actually meant was from the Promotoras a Latino Health Access. Showed me that in order to move the needle on equity, we had centers of leadership that are most affected by inequities, and that we can't just do work around at the top level service, but we really have to address the root causes. And so I have been partnering with Latino Health Access since the pandemic started, since before California shut down, to mobilize our communities. And I sat with Promotoras as we planned the first $3 million grant in Orange County for a pandemic response with inequity work. And it's through that work that we've done along with, and then we partnered with the Promotoras with Ohio State University and Dr. Syra Nawaz out there in the back as well, to understand what made the promotor work so effective. And those learnings were actually what I took and then included some of those strategies in this grant. So again, I think goes back to something that Cecia mentioned earlier in our chat. Community always has the answer. We just need to be willing to show up and partner with them and elevate that work. So thank you to Promotoras who taught me, and thank you for everyone for being here.
Oh my God, okay. So I'm actually gonna go back to Gloria. So I'm gonna pass the mic back to you, hot mic. And so the question that I have for you is, we know through Ándale, Qué Esperas, we've been able to see how closely individual decisions are aligned with community, right? To wear a mask or not to wear a mask for community, to vaccinate or not vaccinate for community. We know that the individual decisions we make impact family units. So like we've known this for a long time as Latinos, right? And so, you know, guiding ourselves in campaigns through this kind of viewpoint is important. But we know we've been talking about the pandemic not being over, right? But then we've also been hearing about how health disparities have always existed, right? And so the question for you is, beyond COVID-19, what are the health disparities that you see our community facing next?
Yeah, so for a very, very long time, chronic disease has been really present in our community. You talk about choice with that, but there's a big piece where choices are still dictated by the conditions under which we live. A veces hablamos, ¿verdad?, que tenemos que escoger, que poner la máscara, ponernos la vacuna, pero muchas veces esas decisiones son decisiones de nosotros, pero bien poquito. Mucho está afectado. Tengo que, sí, es mi opción elegir a la vacuna, pero también eso significa no trabajar un día, que va a significar no poder darle alimento a mi familia, no pagar la renta. Entonces sí puedo, pero la verdad no es una opción, ¿verdad? Así es que, so when we think about the choices, individual choices, and what comes next, we think about how the pandemic hasn't solved issues around chronic disease. We think about how the pandemic hasn't solved, but instead has exacerbated issues of mental health. We think about housing crises that were already, you know, on the brink and about to pop before the pandemic, and were also exacerbated during the pandemic. And all these issues have similar root causes. And at the root cause, it's kind of that powerlessness, forced powerlessness in our communities And so that's when we start thinking about, now that we're facing into an endemic, how do we take a multi-tiered approach to be able to address some of those long-standing health disparities?
Thank you so much, Dr. Montiel. And I think it was really interesting, the one of the slides that we saw from Dr. Barbara Ferrer, where it talked about equality versus equity, right? And we often, and I like your point on choice, right? We often assume that we're all starting from the same place and we have access to the same choices. And we saw through this pandemic that that's not the case. You know, my background is civic engagement, political work, and it's just so aligned, right? We're going to talk a little bit more about that later today, but it's just so important for folks to understand this. And who best to understand this than us ourselves, right? Coming from those communities. So my next question is for you, Rosa. So Rosa has been our boots on the ground, and I know that sometimes, you know, we would email Rosa like during the day, and then all of a sudden get an email response at like 2 a.m. And I'm like, Rosa, what are you doing? She's like, I was in the field all day. And so I think that is such a critical point, because you get to hear from the community, you get to listen to the narratives. You know, oftentimes we see the news and they say, well, you know, this is the bit of disinformation that we're hearing today. And there's like no context, like, okay, well, how are you addressing it and why do they have those fears, right? And so the questions that I have for you are kind of all related, but a couple of questions. One, can you tell us a bit about some of the most impactful narratives that you've seen and heard in our communities? The other portion to this is what stands out for you the most? Any stories to share with us? And were you ever surprised at the health disparities beyond access to vaccines that you saw? And I know in having just kind of individual conversations with you, shared like, hey, some folks don't have access to transportation, some folks don't have housing, some folks are losing their housing, right? So just want to hear a little bit more from you about what you saw and heard.
I can actually go ahead. I'll start in Spanish. Creo que para mí lo más impactante fue no las historias de miedo, las historias de como trauma, que quiere decir que a veces la comunidad piensa que nos tiene que contar en las puertas cuando nos preguntamos qué es lo que te pasó durante la pandemia. Y a veces la comunidad hasta como que quiere contar esas historias, pero piensa que eso es lo que nosotros queremos escuchar. A veces no quieren contar esa historia. Entonces, las historias que me impactaron más fueron las historias de poder, las historias de resistencia, las historias de esperanza. Por ejemplo, tenemos uno de nuestros embajadores, Faustino, él vende bolis, y lo contratamos como un embajador por una organización que se llama Action. Y hace un mes más o menos me estaba contando de que él estaba haciendo outreach con diferentes folletos mientras estaba haciendo bolis. Y en su camino se encontró a dos personas, una pareja, y esa pareja se lo encontró, le compró bolis, y la señora empezó a llorar y le empezó a decir, es que tú me recuerdas de mi papá, y él falleció y nunca pude regresar a mi para mirarlo. Y Faustino nos contó de que él y la señora estaban llorando en la banqueta, como me quedo en la banqueta, y el señor ahí nomás parado, y luego estaban platicando sobre México y sobre las vacunas y todo, y al final terminaron contando de que varios de ellos eran familiares. Y dice, al final terminamos ahí los tres llorando, abrazándonos, juntándonos. Y dice, pues no te preocupes, les dejé 100 poquitos para que ellos los repartieran con sus hijos. Entonces, o sea, que él me pueda contar esa historia de su corazón, porque no fue una historia que yo le pregunté, cuéntame qué es lo que más te gusta. Más bien fue el que él está emocionado de lo que él pudiera haber hecho, y que son esas conexiones que activaban a su comunidad. Gente que ni estaba vacunada, que él los convenció que se vacunara y aparte les dejó 100 folletos. Eso es lo que a mí me enseña. Porque eso es lo que a mí me enseña de que la comunidad, aunque pasamos por todo lo que hemos pasado en esa pandemia, hay tanto poder, hay tanta esperanza que vamos a salir de esta. Entonces, bueno, eso es lo que yo pienso que más me ha impactado. En términos de estar sorprendida, no, creo que bueno, no estoy sorprendida de lo que hemos venido a las puertas. Para mí es muy importante estar con mi equipo, o ir con mi equipo por lo menos consistentemente cuando estamos en eventos o lo que sea, porque ¿cómo voy a saber yo qué decisiones tomar si no estoy escuchando lo que ellos están escuchando? ¿Cómo voy a saber yo qué es lo que la comunidad ocupa si no paso tiempo ahí? Siempre estoy como atrás del computador, entonces siempre he tratado de tomar 1 o 2 días en el que yo estoy con el equipo consistentemente. Pero para mí no era de que hay que descubrir qué imbalances hay. era más bien, hay que descubrir la evidencia, porque la comunidad ya sabe que hay imbalance, la comunidad ya sabe que hay mucha gente que a lo mejor tiene diabetes que ellos lo saben y lo tratan en su casa porque saben que no pueden ir al doctor. O gente que dicen, ay, no voy al doctor porque luego si me encuentran algo y ahí ya, ahí quedé. Muchas de mis familias dicen eso, entonces no era importante para mí, explíqueme qué es lo que está pasando, pero más bien, ¿qué podemos hacer para ayudar a la comunidad para que ellos puedan tener más recursos para abogar por sí mismos? Para que nadie pueda decirnos, esas nomás son historias. Entonces, para mí lo sorprendente fue la evidencia tan fuerte que encontramos, de que todo lo que nosotros hemos estado diciendo, de que hay tanta inequidad, hay tanto imbalance, es cierto. Y ahora tenemos por lo menos datos que lo puedan respaldar. Sorry.
Is there, I don't have to say that. I was gonna say, is there any monolingual English speakers, but yeah, maybe a bit.
Yeah. I was saying that the most impactful stories that I've heard have not been ones that are kind of rooted in like community trauma, you know, what folks had to go through. Because a lot of times folks feel like they have to tell us those stories in order to be heard first. It's really the stories where you can hear the hope and the power in their voice as they're telling you those stories. The story that I kind of told was Faustino, one of our street vendor ambassadors. He does outreach while he's selling bolis, which are just like popsicles that he makes in his house. And he was telling the story of like him just stopping to sell this couple, and then somehow he reminded the woman of her dad, and they all ended up hugging and like crying because, you know, he had passed away and she had not been able to go. And then through the combination of the pandemic and COVID, they talked about kind of like losing family members, and then he ended up leaving them with like 100 flyers for the couple to give out to like neighbors and things like that. And it's those stories where I don't have to convince anyone that there's power in our communities. I don't have to convince anyone that there's resilience. You can see it. And not because I'm telling you all this, but because there's a video somewhere where you can see Faustino, like you can see the way in which he speaks and the way in which he expresses himself, not of what he did, but rather of what they did together. Like it wasn't like, oh, look at how I empowered them. It was like, look at how our connection led to this amazing thing. And I think that it's those moments that really ground me and that really inspire me to know that we are going to get out of this, and that we're not going to get out of this from like blanket level solutions, but rather from community itself leading the way, because they'll be able to inspire change in ways that we can't even conceptualize. And then in terms of like being surprised about, I guess, like finding health inequities, we didn't really ever go into the field trying to figure out the problem. We already kind of knew the problem, so my whole team is from the communities that we're working with. And one of the things that is really important for us is for them to center their lived experiences and what they know to be true, even if there's not data out there. Like if everyone in your family is afraid to go to the doctor, something is there. We don't need the data to tell us that there is inequities happening. So I think for us, the shocking thing was how much evidence we found of the things we already knew. So people can no longer say those are just anecdotes, those are just like, you know, stories you hear in community, like those are real. And it's not surprising, but it's, I think, incredibly shocking that people can still sit on an ivory tower and tell us that these inequities are not true.
On some of what Jessica was saying, so I was like, oh, wait. And we'll ask a couple more questions later down in the panel on the work that you did with street vendors. I think it's really awesome, right? And it's so interesting that you mentioned some of these points, because I remember I too also worked on the census campaign, right? Before coming to Alphamed, and I remember going to present at this conference in like Kentucky, right? Nobody looked like me. You know, and they were, you know, I was like, oh, well, you know, when I was young, my mom used to mobilize her comadres that sold Avon. Like that's how they would do door knocking, right? They would get recruited by campaigns and door knocking. And they were like, oh, wow, this is just like amazing, right? And I'm like, yeah, because Latinos and immigrant communities generally don't trust government, right? And so they hear it from La Señora that sells on their ice cream. Like, yeah, you got, you know. And it was so interesting how they were writing copious notes and all that, right? And I was like, how about you just work with us because we know our community, we come from there, right? And so there's still a lot of work to be done, right? Even outside of here, outside of some of the communities that you all do work in, outside of the state, even, right? So my next question is for you, Noelia. You know, CDPH continues to run its effort of vaccinate all 58, which means vaccinate all 58 counties. Where do we go after the all 58? Let's say on a, you know, hopefully this wonderful scenario where we vaccinated all 58, right? What is the next priority for CDPH? What do you do with the partnerships? What would you say is really the next step for this effort?
So I'll just start by saying we'll always be busy, meaning there's always going to be a next crisis, a next community need, something that we need to address, right? So listening to Gloria and Rosa just reminded me that we need to start with always listening to community and asking them, as they're the experts and advocates, what does the community need? What do our people need? And right now is the pandemic, because we just had to step in and do something about it. But we'll see what's next, right? And then we'll listen to community. We need to trust our trusted messengers and community to do the work. Again, we don't go in there and tell them what to do. And I think that is really important for whatever comes our way. I know the state recently announced their smarter plan. So we are looking at not just thinking about this moment, but how do we address the next thing, right? What's going to be next after this? So we're really keeping our eyes and ears open, listening to community. And a lot of what we're hearing is some of the what we're hearing from our sisters here, right? That it's not just about vaccine access, it's a lot of other issues that we knew about, that there's not equal access to healthcare even, right? Like I didn't have my insurance until I started going to college. I didn't even go to my first OBGYN appointment until I was like in my 20s, right? So I think it's also like it's all connected, right? It's not just this simple black and white thing of like, oh yeah, just vaccines, but also it's really important to think about how we're wrapping around our communities to provide address the many needs that they have. So I think one thing that has been amazing working with our community partners is while we're doing work that's very focused on vaccines, we know that there's other services that they need, health screenings, maybe they need rental assistance, like information about programs that the state has. So it's been, it'll continue, and again, we'll be busy. We know that right now, we've gotten so far in the last 2 years, but there's a little bit more work to do. But even when the vaccine, even after vaccines, whatever that may be, we're always gonna have this community and this network of trusted partners to really tackle what's next.
Okay, because we know that there's the work that we do in the field, right, that we all heard about, that we reach communities, and then there's the work that we have to do at the state capital and at the nation's capital, right, to make sure that we address the disparities, right, that as we're tackling them, that we're also communicating them and holding people accountable. And having been in meetings with Bede, where she's kind of asked the staffers, hey, what are you doing on this? What are you doing on that? It's just been so incredible to see how that has so much to do with the access to care, the access to vaccines, the equity that we talked about. And so I want to hear from you, Bede, on what were some of the major challenges, right, when it came to access to vaccinations, right? When I was onboarded, I remember Bede telling me like, oh, in the past couple of months, I have like slept just a few hours because I was, we were dealing with all these issues. So what were some of the major challenges? What continue to be some of the major challenges? And what are the asks for elected officials when we talk around this world?
I told you I always get the hardest questions. But I appreciate this question because I really do approach it at a system level, right? So we're all here because we don't want to lose what we've all created, and we want it to continue to live. That's number one. Two, I want to, throughout the day, I want to continue to invite you all to tell us what worked, but also what didn't work, right? Because in the work, and I love that you have committed to continue to work with the community partners, because often what we see is this kind of schizophrenic response, and all of the institutions, you know, we're a large institution ourselves, right? To try to go do the thing that we think the community needs. And so these are all really great reminders that we are receiving, right? Part of it is activating, but let's make sure we're activating in the right way. So just, you know, I invite you all to think about it in that way today, and bring us the best practice. But to answer your question, Lizette, you know, I think, yes, at the beginning, it was really, really tough. I shared a little bit about, you know, kind of looking around, driving around our communities and not seeing any testing sites, right? And so we literally took the fight all the way to the Trump White House at the time. Community clinics were a complete afterthought. Yet we are the infrastructure, and often the most comprehensive infrastructure nationally and across the country in the most underserved communities and under-resourced communities. So that was the first fight, right? Include us. You need to include us, because the folks that you all are trying to reach every single day come through our doors, talk to our promotoras, trust their provider in a way that unfortunately they don't trust an institution. That's number one. And so that message, thankfully, resonated with some leaders at HRSA specifically. And so they said, absolutely, we have to include community clinics. And so we started to see some of those first shipments. Then we spoke to our colleagues at county, and we started to LA County, and we started to receive some of those tests. So that was the first fight. But as soon as we got those tests, right, we knew that we needed to immediately pivot to vaccines. At the time, the vaccine was still under development. We knew it was coming. And we also knew that because, unfortunately, we continue to repeat the same mistakes, we're smart enough to know that we needed to anticipate the same thing, right? That as our communities were dying, we knew we were not going to get the vaccines first. And unfortunately, we didn't receive the vaccines first. If you all remember, it was the big hospitals and healthcare institutions that received the vaccines first, because the word on the street was that they had the big freezers, but so did we. Some of our community clinics immediately mobilized and purchased those big freezers, and we're like, we have them too, give them to us. We need them, our community needs them. And so that was the next fight, right? We went all the way to the governor's office, and we were the first clinic in California to receive those vaccines first here in LA County. And with that, right, the message for us is always, and for me, is always like, it's not just ultimate. We have community clinics across the state of California and nationally, and you all need to include that, right? So that was the message that we were, you know, when we were talking to elected officials, we're like, we need masks, we need PPE, we need tests, we need vaccines, and we need you all to keep them coming. Because as soon as we're getting them out the door, right? And then the fight became the funding, right? Because we didn't know, right? When the pandemic started, we completely shut down our clinics, our dental offices, everything. And we thought we were going to close, to be really honest with you all. And so in all of the conversations, we're like, but also make sure that as you all are sending all these funds to state and community, and that they're coming to community clinics and to promotoras and folks like the Latino Health Access, because we're the ones that need to be out there doing this work. And then we also won that fight, right? So one of the big products of that was the American Rescue Plan Act. And we got millions of dollars allocated to community clinics across the state and nationally to continue to keep our doors open. So that was a major, major, major fight. And now we find ourselves in this outreach phase, right? And we have been in this outreach phase for a long time. And so the message with our elected officials and community partners continues to be prioritize us, right? If now you're touting health equity as your main priority, then you need to make sure, especially here in California, that Latinos are at the top of that list. Because again, we lost the most. We lost the most. Y hasta allí. We don't have to go past that data point. And I often don't. I don't have to, because nobody can say to me, Latinos didn't die the most. And so there is where the conversation always starts and ends for me. And, you know, really making sure that our elected officials are talking about the right things in our communities, and that we start to target things like the social determinants of health, because again, back to this community that you all have come to, Sela, right? The choice, I love that part about the choice, right? That is, it's not a choice, right? Just because we're giving someone coverage doesn't mean they have access. Right? Just because we're saying, oh, we're bringing vaccines and tests to this community and we have a clinic, doesn't mean that they don't live in a community that's under-resourced, surrounded by freeways with bad air, that, you know, Delta flies over this community and dumps jet fuel over this community, that Exide and the Exide plant existed here, and now the folks that live in these communities can't even eat an orange from a tree that's planted in their yard because there's high levels of lead in the ground and in the dirt. I mean, all of that, right? And so that's the fight now. We now have a model, and I'll end this portion by saying that because of all of you, we've now built a model in the state of California where we have our own infrastructure to mobilize Latinos in urban and rural areas across the state of California. Nobody else has that except for us. And so I just want to underscore that, because we can take that into Medi-Cal expansion. We now have the 50+ Medi-Cal expansion, hopefully a full expansion by January 2024 to everyone who qualifies for Medi-Cal. We have the elections, we have the next issue of the moment that's going to come. And so we have the strongest of foundations to carry that work forward and to continue to hold our elected officials accountable.
Question is going back to what I'm looking at. And shout out to, I saw her earlier walk in. Where's Wilma at from the Stella Collaborative? Where's she at? Oh, she maybe walked out. She walked out with the, where's Wilma, right? Where I was gonna, so the Southeast LA Collaborative is actually a collaborative that went straight into action here in Southeast LA. So I definitely wanted to give her a shout out when she comes back in. So the question that I have for you, is, you know, one of the big components for this work, for this particular grant and this campaign was workforce, right? The fact that through this work and through you all, right, we onboarded 123 community health workers, you know, we call promotoras, and how for years now, I feel, right, there's been this conversation about the importance of promotoras and conversations and conversations on conversations, right? And I think that the pandemic and this work solidified the key importance that they are as skilled workers, right? And as key workers for this effort. I know you talk about this quite a bit, and I learned from you every time that you talk about it, because again, I'm pretty used to this space. And so just wanted to hear from you a little bit more about what you learned through the Ándale, Qué Esperas work on the important role, any models that you can share with us, and really just any highlights, lessons learned from this work.
Yeah, so again, promotoras have been my public health institute as well. But one of the things, right, that we learned is that historically promotoras have just been, or the promotor model has been leveraged for a very tiny piece, which is just providing direct services or health education. But we learned that when we now partner with promotoras and really design equity campaigns, advocacy campaigns that we mobilize community, it has the potential to not only affect individual health, but also community health. Entonces, la importancia es no solamente de ser socios con promotores para ayudar a las personas individualmente, sino también impactar sistemas que van a ayudar a la salud comunitaria también. HRSA currently has another call for proposals for promotor training. And again, this is coming from a place of HRSA and just the public health system really recognizing the role of promotores or community health workers as well. So in the state of California, actually, the leadership of the California Healthcare Foundation recently awarded a capacity building grant to several regions throughout the state of California to continue mobilizing promotores and continue to integrate promotores into the healthcare system. The one thing that I will say though is that for those healthcare systems that are here, that it's really important to not think of using promotores, to not think of just having promotores here to do what we as health systems seem important, but to really value the expertise and the root of promotores in partnership in community, the trust that community has with them, to be able to design better ways to reach community, to better design interventions that will ultimately help community, our health systems, and also community health in general. So, para los promotores, su trabajo ya está siendo reconocido más y más en el estado de California y por el gobierno federal también. El gobierno federal ahorita tiene una solicitud para propuestas para entrenar a más promotores. El estado de California también ya escogió como 6 o 7 socios regionales que van a liderizar al trabajo de promotor para ayudar a crear capacidad en los sistemas de salud para mejor entregar el modelo de promotores. Pero lo que yo menciono también es que ustedes no nada más son personas que usamos nosotros para tener ciertos logros en salud pública, sino que ustedes de verdad son el corazón de este trabajo y de las comunidades. Entonces, ustedes son los que necesitan liderizar este trabajo con los sistemas de salud. Así es que muchas gracias a ustedes y vamos a esperar que estas conversaciones y los fondos lleguen para seguir entrenando más promotores y para ayudarles a ustedes también a crecer como líderes en su comunidad.
I'm texting with Octavio just in program. Rosa, the question I have for you is around the street vendor program. This was truly just innovative work and also very important work because we know that there's just so much fear in the community, right? And I say this in particular, like I mentioned before, having worked on the 2020 census campaign. It was a challenge to really go out into community, especially under the administration at the current time, right? To go out into the community and say, hey, fill out this federal form, it's good for you. I'm like, no, you know, and so we needed these trusted messengers, right? And every time that we, you know, that I remember kind of doing briefings in DC or whatnot, and it's like, well, can you give us an example of like a trusted, is a reporter a trusted messenger? Is it, we're like, actually, like, you know, like there's research, yes, but like honestly, just ask us. We don't really need research behind that to let you know who our community trusts, right? And so really seeing folks like street vendors as key folks in community, as key pillars for outreach efforts, right? In the future, I think is key for all of our work moving forward. And so I just wanted to get a sense from you of what you learned through that process. What is the next kind of phase of this partnership work, right? And how this all kind of came about, because I'm sure there's always that one, right, that introduces to other partners, right? And so just want to learn a little bit more from you on that.
Yeah, I'll start this next again. Para nuestro programa de embajadores vendedores son, bueno, esta idea se nos ocurrió por Felipe, que está ahí atrás. Estábamos en una junta, creo que era como su segunda o tercera semana, y estábamos en una junta pensando sobre, sabemos lo que no sabemos muchas cosas en este punto, era como junio 2021 más o menos, apenas acabamos de agarrar el grant y estamos empezando a planear, y lo único que sabíamos es de que las historias de que los latinos nomás no querían la vacuna, nomás no queríamos estar bien, no nos importaba nuestra salud o lo que sea que estaba saliendo, de que por qué éramos vaccine hesitant, no eran correctas. Y lo que sabíamos es que no podíamos hacer ese trabajo de ese punto de vista, porque si lo hacíamos, estábamos mirando a nuestra comunidad igual que otra gente que no es parte de la comunidad nos estaba mirando. Entonces, empezamos a pensar como, ok, si nuestro goal es traer a 100 personas a un evento, ¿qué otras formas tenemos de hacer alcance? ¿Qué otras formas tenemos de activarnos? Entonces empezamos a pensar que vamos a swap meet, vamos a diferentes lugares. Mucha inspiración salió de Latino Health Hacks, de todos los videos que estaban en Facebook, y se lo dije muchas veces a Loreta, de que ya la verdad nos inspira mucho. Bueno, ella y los promotores. Entonces, lo que empezó es de que, okay, hay muchos vendedores ambulantes, nosotros no tenemos la capacidad, pero en el 2018 hubo una campaña donde los vendedores se activaron para decriminalizar que ellos pudieran vender en las calles. ¿Quién los organizó? Entonces fue ahí que encontramos a Inclusive Action. Y ellos, creo que ellos nos enseñaron cómo trabajar con comunidad donde ellos son los líderes, la verdad. Ellos, antes de introducirnos, creo que nos juntamos con ellos fácil unas 20 veces, desde octubre hasta febrero, cada semana. Y no fue hasta diciembre que ellos por fin dijeron que sí a la alianza, porque ellos protegen a sus comunidades y no iban a dejar cualquier organización nomás entrar y arruinar todo lo que ellos habían construido con los vendedores. Entonces, fue encontrar a alguien que ya sabía cómo hacer ese trabajo, encontrar a alguien que ya tenía la relación con los vendedores para poder decir, ¿sabes qué? Mira, este trabajo es importante. Y aparte fue de veras cambiar nuestro punto de vista. No era, como decía Gloria, no era de cómo usamos a los vendedores. Los vendedores están haciendo esto, ya hay que darles más cosas. Era parte, bueno, era cómo podemos traer este dinero en una forma que de veras traería la mejor, como cambio en la comunidad. Y parte de eso era mirar cómo los vendedores estaban siendo atacados al principio, donde la policía llegaba y les tiraba todo, hasta les quebraba sus carpas, solo porque estaban viviendo durante la pandemia. Y cuando había noticias decían, es que yo no tengo de dónde más sacar dinero, ¿cómo voy a pagar mi renta? ¿Cómo voy a darle de comer a mis niños? Tengo que vender. Y se ponían todos los días en peligro para poder seguir viviendo en ese país. Entonces, sabiendo eso, sabiendo que ellos no eran como algo tan peligroso para que tuviera este tipo de policía, dijimos, esto tiene que ser un programa que nosotros entramos en nuestra campaña. Entonces fue así como nació la idea y cómo nos de veras nos cometimos pues al programa, pero los vendedores son los que hacen todo el trabajo. En febrero lanzamos el programa y en vez de entrenarlos a ellos, dijimos, ¿sabes qué? Ustedes probablemente tienen décadas de experiencia haciendo alcance, porque ¿cómo vas a vender si no sabes cómo hablar con gente? ¿Cómo vas a vender si no sabes cómo decir como, oh, mira, ven a mirar mi puesto, lo que sea? Ellos ya tenían experiencia, no como que nosotros llegáramos a decirles, oh, mira cómo hacer alcance, mira todo esto. Entonces lo que hicimos fue darles más información sobre la vacuna, folletos, materiales, pero ellos diseñaron su propia campaña. Desde febrero han alcanzado a casi 50,000 personas, han repartido más de 15,000 folletos, creo que hemos imprimido para ellos. Y ellos han diseñado 2 campañas de alcance. Una era sobre la ayuda de renta que se acabó a final de marzo. Entonces su idea de ellos era, ¿cómo vamos a hablar a la gente de vacunas si ellos están preocupados porque no pueden pagar su renta? Antes de hablar de vacunas, hay que hablar primero de que se va a acabar el programa y luego ya después de que los agarramos, ya les damos un proyecto de vacunas para que les hablen a ustedes. Entonces, ellos nos escucharon a nosotros a diseñar campañas que metían a las vacunas como a mero abajo, pero fue tan impactante porque por fin la comunidad estaba dispuesta a hablar sobre vacunas, porque las vacunas no estaban al centro de la conversación, eran sus prioridades que estaban al centro de la conversación. Entonces no era de que un sistema estaba llegando a decirles, eso es lo que te tiene que importar porque yo digo que te tiene que importar. Era su misma comunidad diciendo, ¿sabes qué? Yo sé lo que te importa y mira esta información de lo que te importa, pero aparte tenemos que mantenernos a salvo con esas vacunas. ¿Qué te parece? Y eso fue lo que ahora es nuestro modelo, también de nuestro equipo. Entonces, vamos a seguir trabajando con los vendedores hasta, creo que diciembre, y siguen pensando sobre qué campaña quieren hacer en la segunda parte, porque ellos siguen centrados en que tenemos que centrar las prioridades de comunidad, no como nomás las vacunas. Entonces, este programa es un programa que me trae tanta alegría y puedo hablar todo el día.
One secret sauce that we don't often talk about, right? La fórmula secreta siempre es pasión y dedicación. You don't have passion and dedication for this work, you can try to forge partnerships all you want if it doesn't come across, right? We always talk about this, like people have to know that you genuinely want their good and people and our community sees it, right? And so definitely see that with Rosa. She gets really excited when we always talk about that. Like, what did you do? What did what did the community say this time around? So thank you for your work. Now I want to go back to you, Noelia, on the work for CDPH. We've been talking a little bit about what we in this work we're calling support services, right? Where we talk to the community and then, yes, I want to get the vaccine, but you know what? I don't have childcare. Yes, I want to get the vaccine, but right now my biggest worry is that I can't pay rent because I haven't been working because, I got sick with COVID. And so in terms of the work that you all did, right, at the state and working with community partners, what were some of the key support services, right, that really bubbled up to the top? What was some of the work that you all did around it? And then just kind of any successes, right, on connecting folks to that.
So let's see, where should I start? So the state funded a network of CBO partners across the state, and we work with them to host not just vaccine sites, but also community events that have different kinds of services available. Some of the things that I think what you shared really resonated because one of the most effective ways to reach community to talk about vaccines in this case was to first build that relationship and like talk about the other things that they cared about, right? The other things that worried them, the other things that they had on top of mind. Because if, for example, you're fearing not being able to pay for rent, it's how do we get, there's a journey involved with like even getting to vaccines for a yes, right? So if you're worrying for rent, like how can you receive the message of like, oh, this is important because it's going to keep you healthy, your loved ones healthy, your family's healthy. So I think a lot of what was shared did come up a lot. We have a model, so we have a state-funded network, but we also host collective impact tables. It came out of the census work. We knew that we needed to create spaces of collaboration and planning where the people at the table were community members, people who work with them every single day. And then a lot of those things bubbled up, right? Like, it's not just about vaccines. These people are also, these community members are also worried about other things. It's fear. Also, it could be misinformation about the vaccines as well, right? Because there's a history of with certain communities and their access to healthcare and like how they've interacted with healthcare. So I think a lot of the issues that were highlighted, rental assistance, health screenings, even things that public charge is still a thing as well. People worry that if they access vaccines, there might be consequences. So I think we look to our community partners to really do what they know best, really. And sometimes there's not like one solution. Everyone goes through their own vaccine journey, and then sometimes the gateway or the way to like get to that person is going to be rental assistance, talking about empowerment. Like sometimes it might be advocacy to kind of give them a voice, right? To make them feel heard about all the other complex issues that they're going through. So I don't know if I answer your question, but because I feel like it depends on the community member, right? It's not always going to be everyone is going to worry about one specific thing. So I think really like going to the community and figure out what exactly their concern may be, and always taking back our learnings from on the ground. So we have definitely research and data and all of that to inform our work, our messaging, what is really gonna give the information and the tools that people need to get to a decision. But it's also, again, the community insights that we get to really tailor the messages and the information that we know is factual, so we can deliver that to the individual so they can get to to the decision that they need to make for themselves.
Thank you so much. And I think what I heard from you is the importance of community partnerships, right? The importance, and I think as, you know, for many of us who have been working on organizing communities for a long time, it's like you start on an issue, right? And then all of a sudden you have to connect community to this because it's also an issue. And then all of a sudden you have to address this, right? Even, you know, as folks were, and again, it brought me back to memories with the census work, right? Where we were like, well, fill out the form. And they were like, well, you know, what about, where do I get information on like becoming a citizen? And you're like, oh, well, here's this information. Also, where do I get information on registering to vote? Okay, that's different. It's not this form, but let me give you this form, right? And so kind of knowing that network of organizations and the network that those organizations have, right? I think that's what I heard are like important and key to plugging it. Yes, go ahead.
I'm getting flashbacks of my work with community organizing. Sometimes you are put in a role where like you have all this knowledge and you want to share everything you know because you know there are resources available. So, and like you want people, like you want to empower them, you want to give them hope. And then, you know, when you have a conversation, sit down with someone, you learn about what are the other concerns that they have, right? That is why trusted messengers are so important because they know that, right? So when we sit down with them, it's like, oh, you may be talking about one issue, but also like other, like we're complex. Like it's not just one single thing that people are gonna be in their mind. So for immigration issues, for example, like it's also fear at times of government or like discrimination with housing at work, you know, educational access, like not being able, like, can I go to school? Like, so I think once you actually have a conversation with community, you learn that entry point. You learn how to navigate that, and you know, that is the power of community because they know that. And I think that is really like, again, I sound like a broken record, but our community partners, sometimes that is a church, sometimes that is a school site, sometimes it's going to be the doctor, and you know, it varies. So I think that's really important.
Thank you for that. So my next question is, I'm sure everybody really loved the data entry part, right, of this work. It was really exciting and really, I know it was a lot. We get it. I know talking to our OSU friends and Dr. Noah is like, we were on the phone all the time, like, how do we make this more accessible? And it's such a challenge, right? But a big part of that is also the takeaways that we got from the data, right? As we were having conversations, as we were pulling together presentations, right? As we were working with the state, with other partners, right? We're trying to figure out like, how do we do this, right? And so know that the data, you know, in aggregate went far and wide in terms of what we could do with it. And I know part of the role that I played was sharing some of those findings of the data with Vede, right? And part of that piece was also kind of sharing what were we learning on the ground with folks at the Capitol, with key organizations, with just key folks in leadership, right, and folks that had access potentially to funding or to make key decisions. And so, what were some of the takeaways from the Ándale, Qué Esperas campaign that were helpful to you in your work and in having conversations with key leaders, right, across the state, were really helpful to you in driving the point home in terms of more investment in community and culturally relevant models?
So I think the number one thing that, in fact, you have taught me is that what makes our work different is that we are a direct service provider. And so oftentimes when people come into community, they're, you know, they don't have that brick and mortar site in the community where, you know, if we say something, right, if Optimed says something or San Isidro Health says something, like someone's gonna, they know where to find us, right? And so, and one thing that Rosa was saying really resonated with me in that organization, right, that you all work with the street vendors, right, they're very protective of that, right? And so the relationships in the community, and we are too, right? We're not just gonna let anybody in our clinics. We're not just gonna let anybody engage with our patients and our community members. And so that has been a critical piece of this, right? That, we are brick and mortar in these sites, and we are the infrastructure across the state, and we are often overlooked. And so the fact that community leader, government, the federal government, let's start there, didn't immediately come to the infrastructure that they actually built, which are community health centers, is just mind-blowing to me, right? The fact that we had to fight so hard to be added as testing sites, to be given tests, to be given vaccines, to be supported even. Because a big part of this is it's so much bigger than vaccines, right? Not only have you all been out there talking about vaccines, but, señora, ¿cuándo fue la última vez que fue a visitar a su doctor, right? Like these vital screenings, right? That we're actually helping people get the primary care and preventive care that they need so that they don't end up in a hospital system, especially during the time where the hospitals were just flooded with patients, right? We had a key piece in that. And so connecting it for elected officials and leaders has been a challenge, to be really honest, right? Because for something that comes to us so obviously, right? Like, of course, like we're doing this work, we should be a critical piece. It wasn't necessarily the case, but because we have all done this collective work together, we had that critical data to point to. Real time, every month with HRSA. One of the big things that I want to shout out is just how, and I hope you all have received these messages from your key leaders in this work, but where we are like the shining star for HRSA in this work nationally. Our campaign, every time it was like, cuatro, 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 right? Because nadie estaba haciendo ese trabajo en el nivel and really how professionally it was all done, right? It was done so well that really no one across the country was doing this work. And a reminder, we were the only community clinics that were selected for these dollars nationally, right? We had other really big players like clinic and trade associations and health departments and all of that. Our partners at the LA county were also recipients of grant dollars that we received, right? But we approached this work really differently. And so for me, it has been about helping leaders connect the dots, right? Like you all do for me, like we do for each other, because it's not as logical. But I think now, right, one of the major wins, in addition to the American Rescue Plan Act, the American Rescue Plan Act, yeah, ARPA, was the fact that when we got a new president, President Biden, the fact that his COVID response team immediately identified community health centers as a critical piece of this work in the COVID response, right? That was a major thing that without our work would not have been possible in terms of the advocacy at the beginning. And that's ultimately what led to this funding source, right? When they had all of these dollars available, community clinics had to be a critical part of it. Another result of this work has been direct vaccines from HRSA to clinics, right? And I know a lot of you all know that, but that didn't exist at the beginning, right? So then HRSA recognized, community clinics are a critical piece. They need to receive these vaccines directly from us. And then that goes down to the local level, right? As this work and these findings came out and we were reporting the results, our partners at HRSA, state partners, the governor's office, local entities were really kind of uplifting our work. And this moment, Wilma, you left at a very opportune moment a little bit ago, but I want to shout out amiga, hermana, colega, Wilma, Dr. Wilma Franco. Up the Southeast Los Angeles Collaborative, which Ultimate is a proud partner in. She, I will say, almost single-handedly was also the one that led the effort for the FEMA mass vaccination site here in Southeast Los Angeles and here, like specifically here at this location. And with your tiny team of maybe 5 people at the time, 3 at the time, worked with FEMA for weeks upon weeks. I remember it was supposed to be a couple of weeks, and then it kept getting extended, and then we had líneas out the door and around the corner, and you know, it's critical leaders like that and partnerships like that that, you know, understand and are connected with the communities and understand the infrastructure that exists in a community. And so big shout out to that, to you specifically, Wilma, and thank you for being our partner in the work with the Ándale, Qué Esperas campaign.
Standing between you all and lunch. And so what I want to just do really quickly, just rapid fire, right? Go down our line of panelists and just final thoughts, right? Just brief a couple of you know, empowering words for folks to move with, right? I always tell folks, whenever I end a panel or a conversation, I like to leave with like, here's my closing, right? That folks know like what my one-liner is. So I kind of just want to go down the line and get final thoughts from you all before we close out. Oh, sorry, that.
Coverage does not equal access. And so we need to make sure that folks who now have access to Medi-Cal through our work and our everyday outreach can register for the care that they need, but then we need to make sure that the system that is there to serve them can actually serve them in their language. And so I invite you all to join us in this work.
Final thoughts. Extremely grateful to be here and surrounded by folks who are on the ground every single day, making things happen. And please talk to us. Like, we always want to learn how we can support you more, how we can support our community. And come to our collective impact tables. Those are spaces that are, we do those regionally, where we want to hear directly from the community, from folks like you, of what's working, what isn't, and what we can do better. So thank you so much.
Excellent, both English and Spanish. I think my final thoughts, and I like to say this a lot of places that I go, I think it's a reminder of myself and for other folks who do work generally with community, it's that community doesn't need to be saved. Community doesn't need to be saved. They don't need to be empowered. They don't need saviors. What they need is access to things. And what they need is equity so that they can step into their own power and their own voice. And so as we go on and we do any type of work, whether it is health interventions or civic engagement intervention or whatever other work that y'all's clinics do at the intersection of all of this work, what is happening to also ensure that community does have the space to tell you like what they need and how they can participate in this and how are we opening up space for them to not be leveraged, but for them to lead us in how we do our work. Because ultimately, it is them who should be guiding all of this, and it is them who should be guiding the planning and the implementation and the evaluation. Because how do we know what community needs if we don't ask community and if we don't make space for community to tell us? And so that I think is something that I tell my team all the time, and that we like to remind ourselves as even in meetings where we're like, oh, like, you know, we need to go in and like do this empowerment thing. It's like, well, is it empowerment or are we just opening a space that maybe they haven't had before because, you know, we're giving them stipends? So just that as a reminder. And then I think for the promotoras here, no dejen que nadie les venga a decir como, oh, vamos a hablar o lo que sea. Creo que ustedes son el ejemplo de todo el poder que hay en nuestra comunidad. Y creo que ustedes son la imagen que viene a mi mente cuando alguien me dice, ¿por qué haces ese trabajo? Y es porque ustedes aman a su comunidad con tanto que dejan todo ahí, ya sea cuando están con su vacuna bailando en los centros, o que están tocando puertas, o que están abriendo conversaciones que a lo mejor nunca se han podido abrir en clínicas. Eso es trabajo de comunidad. Y eso es igual de importante que un doctor o que el presidente que hable o lo que sea. Sus voces importan y su poder ya lo tienen.
Nada más que agregar, solamente como Rosa, recordando que los promotores estuvieron aquí antes de la pandemia, durante la pandemia y mucho después. Así es que muchas gracias por su partnership y estaremos en contacto con ustedes.
ojalá hayan disfrutado de la conversación. Y creo que el mensaje aquí es, ustedes son el poder, ustedes tienen la pasión para la comunidad. Juntos, nosotros hacemos ese trabajo porque ustedes lo facilitan muchísimo para nosotros. Y como ya vieron, la mayoría de nosotros que hacemos este trabajo es porque venimos de estas comunidades. Yo nací y crecí aquí en Bell Gardens, Southeast LA, so, shout out. Vamos a seguir haciendo y queremos tomar ahora un espacio, un par de minutos, para mostrarles un video de todo lo que hicimos juntos. Tengan sus Kleenex listos a un lado porque a mí me pero después de este video vamos a darles instrucciones de la comida, de noche, para que todos podamos ir a comer juntos. Pero, yes, we can just, yes.
Ándale, ándale, ¿qué esperas? Get vaccinated today, ya, ándale, ¿qué esperas?
Ándale.
Ándale, ¿qué esperas? Ándale, ¿qué esperas? Ándale, ándale. Otra vez.
We have one more video for you all. So we've shared that this work has been not only important locally in your community, statewide, but nationally as well, right? So we do have a really cool video from Representative Raul Ruiz, who unfortunately couldn't be here, but was really wanting to send a message to support and gratitude to you all. So without further ado, we'll hear that.
I'm Congressman Dr. Raul Ruiz, and I am an emergency medicine physician and public health expert, and I represent Southern California's 36th Congressional District. I also serve as chair of the Congressional Hispanic Caucus. It is a pleasure to be a part of the Ándale, Qué Esperas vaccination campaign to congratulate each and every one of you on a job well done. Your work has brought vaccines to approximately 100,000 from vulnerable populations throughout California, protecting the health of our communities and saving many lives. As we celebrate this achievement, we also look back on the past 2 years of this pandemic and all that we have learned. We remember the over 900,000 Americans who have lost their lives and the millions who have been infected with Hispanic disease vector brought to other infections and deaths. In fact, in California, we continue to see Hispanics make up a disproportionate share of infections and deaths. The fact is, we cannot continue to rely on a healthcare system that is fraught with disparities and expect a different outcome in the future. As a nation, we must learn the hard lessons from this pandemic to address the shortcomings in our system that have allowed disparities to persist across racial, geographic, and economic lines. That means following the lead of advocates in Florida such as yourselves and shifting our healthcare delivery system to one that brings compassionate care directly to underserved communities. This pandemic reality, we must also take a community-based approach to healthcare delivery that prioritizes equity. As chair of the Congressional Bench Caucus, I can tell you that our caucus is working hard to make that vision a reality. Through the American Rescue Plan, which passed the House with unanimous support from the CDC, we've delivered over $7 billion for community health centers to distribute COVID-19 vaccines and conduct contact tracing and testing. And we secured over $7 billion to bring health services to underserved areas by establishing or expanding community vaccination centers and mobile vaccination units. We pass these resources to equip you with the tools you need to continue carrying out your crucial work and to keep you safe on the job. Going out to administer vaccines to farm workers side by side with promoters in my own district, I have seen the results of this equity-based approach. Because of your incredible commitment to health equity, we will help bring prosperity after this pandemic ends. So, from the bottom of my heart, thank you. Thank you to the incredible organizers of this campaign and all those who were involved, including Berenice Núñez Constant, Escobedo, Cristina Sanchez, Dr. Yolanda Piro, Health Services, my friend Castro de la Rocha, Dr. Jeffrey Reynoso, and Cecia Aquino, the Latino Coalition for a Healthy California. And everyone with La Clínica de la Raza, Latino Health Access, San Isidro Health Services, and Golden Valley Health Center. Thank you for all you do and for your vision and leadership. Your ingenuity, creative thinking, and hours upon hours of dedication to this campaign are an inspiration. Know that in me, you have a friend and a partner rooting for you and working to build a healthier future for all. Enjoy this evening. Ahora en español. Yo soy el congresista Dr. Raúl Ruiz. Soy un médico de emergencia y experto en salud pública y represento el distrito 36 del sur de California en el Congreso de los Estados Unidos. También sirvo como presidente del caucus hispano del Congreso. Es un placer formar parte de la campaña de vacunación Ándale, ¿Qué Esperas? Para felicitar a todos y cada uno de ustedes por un trabajo bien hecho. El trabajo ha llevado vacunas a aproximadamente 100,000 de nuestras poblaciones más vulnerables en toda California, protegiendo la salud de nuestras comunidades y salvando muchas vidas. Mientras celebramos este logro, también debemos recordar los últimos 2 años de esta pandemia y todo lo que hemos aprendido. Recordar a los más de 900,000 estadounidenses que han perdido la vida y los millones que se han infectado, siendo las comunidades hispanas las más afectadas por las infecciones y las muertes. La verdad es que no podemos seguir confiando en un sistema de atención médica lleno de disparidades y esperar un resultado diferente del futuro. Como nación, debemos aprender las lecciones difíciles de esta pandemia y atender la diferencia de nuestro sistema. Eso significa seguir el ejemplo de los defensores y promotoras de salud como ustedes y transformar nuestro sistema de salud a uno que brinda atención compasiva directamente a las comunidades desatendidas. En esta pandemia y en el futuro debemos adoptar un enfoque comunitario para dar servicios médicos que prioricen la equidad. Como presidente del caucus hispano del Congreso, puedo decirles que nuestro caucus está trabajando duro para hacer realidad esa visión. A través del plan de rescate estadounidense hemos entregado más de 7,000 millones de dólares para que los centros de salud comunitarios distribuyan vacunas contra el COVID-19 y realicen pruebas y rastreo de contactos en áreas desatendidas. Pasamos estos recursos para equiparlos con las herramientas que necesitan para continuar su trabajo tan importante y mantenerlos seguros. Al ayudar a vacunar a los trabajadores agrícolas juntos con los promotoras en mi propio distrito, he visto los resultados de este enfoque basado en la equidad. Debido a su increíble compromiso con la equidad en la salud, ayudaremos a traer prosperidad después de que se termine esta pandemia. Desde el fondo de mi corazón, gracias. Gracias a todos por su visión y liderazgo. Su ingenio, creatividad y horas de dedicación a esta campaña son una inspiración. Sepan que en mí tienen un amigo y un compañero que les apoya y trabaja para construir un futuro más saludable para todos. Disfruten esta noche. Ándale.
We're waiting for can folks hear me? Yeah. Okay, so we're waiting for our food truck to arrive, so just to give us a sense. We wanted to make sure that even the meal that the bread we broke together today was also locally sourced by small businesses, by the vendors that we worked with. And so we have one of those vendors driving over right now. So we're gonna have sort of a 10-minute break in between. As soon as we see the food truck, we'll start letting folks know so we can go grab their food. One of the things that I wanted to take, this is a personal point of privilege since I have the mic, is I did want to thank my team who's back there, our civic engagement team. Second, when we talk about like small but mighty teams, that is the civic engagement team. So when you think about like how all this happened and the reports and all this stuff, it's a small team, right? So they were here since last night, came back this morning amidst the HRSA report due tomorrow. They also helped me with amidst us trying to run and get out the vote campaign of 200,000 low propensity Latino voters in like the next 3 weeks. And so just thank you to the team, Cynthia, Jonathan, Leslie, Robert, who's outside. Thank you. So with that, we will go on Octavio, am I right, on a brief break? On a brief 10-minute break. What I will ask is for the folks who just did the panel with us, if you all can come up here for a quick photo. Other than that, please network, meet people you don't know, go talk to them, exchange cards, exchange information. As soon as the food truck gets here, we'll let folks know so we can grab food. Once you grab food, we'll be back in here for the next panel conversation. That will be really exciting.